Hello.
Hello. Okay, it's about 7:04. Should we go ahead and get started?
Sounds good.
All right. Hi, everyone. Thank
Hello.
you for joining us tonight and welcome.
Even
Good evening. Good evening. Okay. Well, my name is Ruby, and I'm honored to serve as your host for tonight's inaugural session, sponsored by the Caribbean American Society of New York, or CASONY, and Trinbago Progressive Association of the USA. Thank you all for joining us as we explore an important conversation this evening around men's health and wellness during the holiday season. It is now my pleasure to introduce our guest speaker for tonight, Dr. Daniel Beckles, who is a Trini. Dr. Beckles is a Trinidadian born heart surgeon with over 3 decades of clinical expertise in cardiovascular disease education and research. He is the Chief Medical Officer of Trinbago Progressive Association and has teamed up with Cassoni to bring clarity, awareness, and knowledge on some very important health conditions. Dr. Beckles is a highly respected cardiothoracic surgeon, and we're truly fortunate to have him with us this evening to share his expertise and insights. I certainly hope that introduction suffices. However, feel free to offer a more in-depth introduction of yourself if you care to. So
That was
without
perfect.
further ado, please turn your attention to Dr. Daniel Beckles.
Hello, everyone. Welcome to this webinar series, and we'll get the slides uploaded. Just give us a second as people still keep coming in. That's great. Okay, can everyone see my slide?
Yeah, we can see it now.
yes, no.
Excellent, very good. We get started. So welcome, ladies and gentlemen. This isn't just another talk about diet. This is about leadership. It's about legacy, about planting the right seeds this holiday season. So let's reclaim our role as protectors and providers, starting with our own health and leading by example. That is really what this is about. So I want to acknowledge, the Caribbean, diaspora that's here. And this really is for anyone. This month, November, is we're celebrating Men's Health Month, National Diabetes Awareness. There's holiday nutrition in there. So we're basically combining this session to it's about empowerment. It's combining science, culture, tradition to protect our family's health. So my goal is to bring clarity, awareness, and not just deliver knowledge, but actionable knowledge, I think, is the real power. So stay tuned and let's get started with this. So we'll start from, I like to give my talks as a holistic perspective and then zoom in to these specific diseases over not just this talk, but hopefully we have this talk for the next few months. So let's get started on that. So for those of you, if you see QR codes, you can take a picture with your camera, just holding your camera over it, and you can basically, click on the button when it appears on your camera screen, and that's how you get QR codes to be activated, and it keeps it on your phone. So that's just a little bit of, information. So when we talk about wellness, someone asks you, are you well? How do you respond, really? And so it's really, if you're at the center, if I can get my pointer up, hold on a second. If you're at the center of this wheel here, you can see here that if you're at the center, it basically 8 dimensions to what wellness is. And you can see here from spiritual, financial, emotional, physical. And this talk will hit on almost every aspect of your health and wellness. So just for inclusion, I just wanted to mention that you have to decide. You can go on the Harvard wellness resource and download this sort of picture, and you can basically start mapping out if you're a 10 out of 10 in everything. But if you're not balanced, you're going to have a really bumpy wheel. So we say that either you have a smooth life or a bumpy life. So just remember that and use that as a good guide. But who is this for? Who is this talk really for? So it's for Caribbean men, ages 35 and above. It's for, family, caregivers, household. It's for women and men. So we don't want to be exclusive. We want to be inclusive. It's for wives, daughters, sisters, community leaders, health educators are the one I want to really get your attention. It's for people at risk for living with or without diabetes or high blood pressure or chronic diseases, and anyone who wants to enjoy the holidays and live long enough to keep celebrating them with their families. That's what this is all about. Let's see if I can move on. So why does this matter? Diabetes rates are 2 times higher in Black and Caribbean Americans compared to white Americans. So Caribbean men are 40 times more likely to have high blood pressure than non-Caribbean peers. And Caribbean men are less likely, very less likely, I would say, to speak about preventative care. And we're going to get into that. So holiday foods can be very dangerous because it spikes our blood sugar and pressure. Many people don't really connect nutrition with long-term diseases. And men really delay their care when compared to women. And so on an average of 3 years longer before they actually go for routine screening. And although I'm smiling at that, it's really not funny. What the huge disparities we're going to talk about, you'll see is number one, that we see that prostate cancer is 2 times higher in Caribbean men. And 1 out of 3 Caribbean men have some sort above age 50 have diabetes. So if you look around your friends, family, you're walking around with diabetes and you don't even know it. 65% of immigrants, actually Caribbean immigrants, skip annual checkups. And we'll go over why they try to avoid these things. And this talk will focus on some myth busters. That means if we can just get that out on this webinar, it would really help move a mental shift in how we think. So let's go over those. So this connection, Caribbean, New York connection. Why are we doing this, right? So over 2 million Caribbean immigrants and descendants, they call New York home, right? And they have higher diabetes, higher hypertension in this ethnic group specifically. And Caribbean people face unique stresses that are different than their counterparts. Obviously, long hours, working hard, the American dream. But we also have diets rich in our tradition, right? And now mixed with processed foods, which we're not aware of until we actually, migrate and we actually come to this country. And it's a fast living pace. And so there's a lot of stresses that we weren't really, getting used to. So I think health education must speak our language, culturally, spiritually, and practically. So we'll go over that. What you're going to learn tonight, some of the real causes of mortality in men, and they're linked to chronic diseases, why Caribbean culture and food matters, and how to adjust them. 10 damaging health myths that I want to get out of you. It's things that I hear my patients say all the time, okay? And we're going to get them out in the open so that we can discuss them in the end if you have questions. How to stay healthy during the holidays without giving up the flavor of the food, okay? We get it. Food is great. And a checklist to help you act immediately after this session. So starting from a holistic view, as I promised, when we look at the causes of why people die on planet Earth, cardiovascular disease still has topped the numbers for decades. And you can see here, almost 20 million people died in 2021. And you can see cancer is running number 2. Statistically, when you ask people, how you think you're going to die? They say, oh, I'm going to die from driving to work, all that traffic. This job is killing me. My kids are killing me, right? We think that some kind of war is going to break out and that's how we're going to die. We think, maybe we're going to die from a plane crash. Oh, wait a minute, vaccines. That's what's going to kill us, is we're going to go get vaccinated and that's going to take us away, right? Well, it's very important that we refocus our mind on facts and evidence and remove as much blind spots as possible. The number one statistical reason why anyone on this chat will not see next year is because of cardiovascular disease or cancer that's going to plague us. And that is a heavy statistic. When we look at now the risk factors for why people die on planet Earth, again, holistically, what they put on the death record are these lists right here. High blood pressure is what kills you. Smoking, air pollution, that's in places that it's really bad. High blood sugar and obesity. Those are the tags that go on our health record and gets recorded every year as data in our world. So let's be very clear. Now, when you look at United States CDC, and this number changes every year, one person dies every 33 seconds. Yeah, the data is out there, but we're not aware of it. We think it's the job that's going to kill us. We think that we're going to get hit, by a train. Something crazy is going to happen, right? In reality, these are facts. And two in 10 people die of coronary artery disease that are less than 65 years old. So I want you to bear this in mind as we go through this talk, because this is the real story. So when we look at COVID hitting us, this is a 4-year running from 2020 to 2024. And in just 4 years, 7 million people died of COVID. And we think that's a pandemic, right? 7 million people is a pandemic. Here I'm showing you 20 million people in just 1 year. In the same 4 years, while people were dying of COVID, there was 80 million people that were dying of cardiovascular disease, and 40 million died of cancer in that same period. So I want to bring crystal clear that this is the two diseases that we have to wrap our health around and how we're going to address that. So this was news to me when I looked at this data, because I can't figure out how come my patients at age 40 is getting a heart attack and getting a stroke. And then we figure out, okay, let's go back to the beginning. Let's ask the question, when does hypertension really begin? And when you look at this study, this is a cohort study that's looked at to give us evidence-based guidelines. You can see that 25% of male population have high blood pressure starting at age 20 to 34. Imagine that. So by the time you get to age 50, you would have had exposure for more than 30 years to hypertension chronically. And if you don't check your blood pressure starting in your 20th decade of life, in your 20s, I don't remember getting my blood pressure checked ever when I was 20, 30, or even 40 years old. So think about that. Now it's routine that 20-year-olds should get their blood pressure checked, because those are the ones that end up finding out with this silent killer called high blood pressure too late. And they want to know, why am I on dialysis? Why am I getting a stroke at age 40? So this is where the silent killer comes in. And this is one of the first myths I want to kill right now, is high blood pressure is for old people. A quarter of men, 13% of women start having high blood pressure according to the definition at an early age in life. And we have to find and screen in colleges, and that's what we're doing right now. It's becoming routine as we speak. Remember, it's going to take time for it to come out in the general population, but that's what you're going to be seeing your kids getting in colleges, getting screened. We hear about athletes dropping dead from playing sports. These are the missed silent killers that's in our society today. So it can happen at any age. I just want to remind people of that. So it's a silent crisis. So these are the silent killers in Caribbean men, but it's in all men, and it's even in women. Okay, imagine a Caribbean man in his 50s, he worked hard his whole life, always putting his family first, right? Rarely went to the doctor, right? And that's the problem we're going to address. One day he collapses at home and he's diagnosed of what? Diabetes and hypertension. The family is shocked. Like, they're just like, I don't know. He didn't have any symptoms. That's why it's called silent. It is very silent. It doesn't make a noise, doesn't have any symptoms. It just years and years and years compounded in the human body leads to disaster. So the hidden triad, when you look at it, is stress, added is the 3 S's, salt and sugar. When you combine that together, that's like having, when you think about a perfect storm, that is the holiday perfect storm. If you think of having a good time emotionally, it's great. Yes, the holidays are coming, Thanksgiving and Christmas. But what's your body? Your body is not having a good time. Think of your heart as an engine and too much pressure inside that engine. And so the fuel, the heat, and it overheats. So the goal is moderation. Just remember that. So these 3 stress fuel 80% of holiday health emergencies. I always wondered why my hospital gets busiest during the holiday season. And now I know why. It's because this is compounded and then you will see why. I'm going to list them in this chat later. The Caribbean foods are delicious, but often double in the amount of sodium, but we're not aware of it. So awareness is the first ingredient to this prevention webinar. And the real problem, why do we wait too long? Why do we wait 3 years or 6 years to go see a doctor? So let's get these myths out right now. Cultural silence around health, especially for men, it's a big like hush hush. Like, are you ill? No, you're not ill. You shouldn't go to the doctor, right? So this is bigger than blood sugar. It's about culture, stigmata. It's about fear. It's about hurting. We have enough scientific data now to show our health is in trouble, and how to fix it. We have all the solutions, but we have to get through this sort of fear of diagnosis. It was once associated that, wow, if you find out you have something, it might be too expensive. And I prefer not to know. I prefer not to find out. So let's not go and find out, right? It was so complex. Maybe there's no solution for what I have. So why even bother? Grandpa died when they found out, what he had. He still died and left us a big bill, right? So all these are the myths that we have to get out of our heads. Care today is easy. You have urgent care centers. It's private. Now we can add 20 to 30 years onto our lifespan easily by following a few little steps that we're going to discuss in the rest of this webinar. So let's not die from something stupid that is preventable. 80% of deaths from chronic diseases are totally preventable. Imagine that. And you're not going to have someone come and force you to do it like they do with seat belts and try not to speed and all these policies. If you wait for that, more people are going to die when we have to take charge as leaders and lead by example. So 70% of our longevity, how long you live, is not based on genetics. It's based on lifestyle. Yes, you heard it here on this chat. It's lifestyle based. So let's get this myth out of the way about things are expensive. Today, if you go on healthcare.gov, all the insurances, if you're working and you have insurance, there are massive amounts of tests. This is just a sample that are all free. You can get free blood pressure screening. You can get free cholesterol. You can get free colorectal screening. You can get rid of cancer. You can find out if you have cancer, yes or no, and get off that statistical ladder saying that cancer deaths. If you get screened for prostate cancer, you get screened for high blood pressure, the #1 killer on planet Earth, that's it. It's that simple. But if you don't get screened for it and find out the hard way, you will really be paying. It won't be free. A stroke can cost you up to $100,000 easily. Okay, so it's not take the free route that can add years to your life, and don't wait for the silent killer to show its ugly head. So life expectancy in the United States. Everybody thinks that the United States should be the best. But how come despite 6,120 hospitals and 10,000 urgent care centers, there's an urgent care center on every block, right? How come that we are the lowest life expectancy compared to our other rich countries? Just think about that for a second. This has made news all over the world. We can learn from them. They stick to screening. These countries, they screen. You cannot collect your pension unless you get your screening done. You cannot collect your paycheck. They tie it to what you're getting, what's important to you. And by doing that, they simply change the whole paradigm of their health. And they're continuing to live longer lives. We are not tying that here in our country, in the United States or in the Caribbean, to anything. And so clearly we have a ways to go. And so the only way we can get the word out is exactly what we're doing now, is to spread it at the table, at the Thanksgiving table, at the holidays table, to lead by example, get your test done and show off. That's the gift you bring to the table. You bring a gift of telling people, I'm going to be around longer because I found out that I don't have diabetes and I don't have high blood pressure and I don't have high cholesterol. that brings a relief to everybody's ear. It means that if they like you though, if they like you and they want you to come around next Christmas and next holiday, it is a gift. So let's look at chronic diseases in America. 6 out of 10 people have at least one chronic disease. 4 out of 10 have 2 or more chronic diseases. Your goal at the end of this webinar series is to have 0 risk factors. Because unlike 40 years ago, where having diabetes, you didn't know what to do about it. Today, we know exactly how to actually get rid of it. So let's look at why Caribbean men avoid medical care like the plague, right? I don't need to see a doctor unless I'm sick. Wow, these are old mantras, right? Why are you going to the doctor? You should go to, your parents will tell you, hey, you're sick. You're coughing like that. You must have something. You go to the doctor, right? But would you go to the doctor without your parents telling you to go to the doctor or your loved one telling you to go to the doctor? That's what we're trying to get rid of here. It's tough. You're not used to it, but you need to go and get your checkup done. The same way you take your car scheduled for service, it hits 10,000 miles, you got to go check this. It hits 20,000, 40,000. The human body have 20 to 40 trillion cells. Okay, it's the most complex and it's the only one we have. And we have to go and get it checked out. And this is the simple way. Now, lack of trust in healthcare providers, well, clearly there's been a lot of fake news recently. And from our personal experience, you go to the doctor and you say, okay, I want, a checkup. And guess what? They schedule you for some kind of test that goes up your butt, right? I mean, it's like, whoa, what is all this? Like, I didn't ask for that, right? So there's a lot of mistrust, right? But it's because as doctors, we fail to explain and communicate why we're doing what we're doing, why we're trying to help you, prevent you from getting cancer and being a statistic. Colon cancer, prostate cancer. The only way for us to find out if you have it is what we actually care about, because we don't want to find out that you have cancer and you have to get chemotherapy and the cost and everything else and the mortality that goes along with it. So the peers that surround us, we're going to get advice from our neighbor with the big belly, missing toes, smoking cigarettes. That's the person we're going to take advice from. Well, that's really fake news that they have to offer us of how to live a healthy life. So stick with this, because this is where we're going to go over how you can become healthy. I hope everyone recognize this guy here, Eric Adams, right? And so clearly, here is he presented in 2016 with severe vision loss. Imagine losing your eyesight, right? Severe vision loss in his peak. Right? He was a cop, right? He, look at how he became Brooklyn, president. But again, he was told by his doctor that he would have diabetes, because his mom had diabetes, for the rest of his life. He was told that, right? And guess what he ate? He was a connoisseur of the fast food dollar menu. Okay, the $1 things you buy in McDonald's, he went there and he just went for it, right? Convenience. But guess what? It caught up to him. He was admitted at my hospital, Kings County Hospital in Brooklyn, okay, in diabetic ketoacidosis, glucose way off the roof, young. He never knew that this could happen to him. How could this happen to him? How is that possible? Well, it can if it happened to him, it can happen to any one of us, okay? And now today he can say his A1C, I think the last time he mentioned it was 5.5, or it's normal. His A1C is normal. I think it was 13 or 14 when he admitted to the hospital. He restored his vision. He wrote a book on it. And he's trying to get this message out to everyone. And this is what this is all about, is carrying on his message that we are all vulnerable. And Caribbean men, African American, it doesn't matter. Any man, any human being can fall into the same trap, because it's a silent killer and it accumulates with processed foods, the foods we eat, the stress of the environment. Yeah, we're going to work in the grind, the rat race, we call it. Well, it's real. So I trained at Kings County Hospital back in the day, got my MD degree from there, got my surgery degree and everything. And I saw this every day in one of the busiest hospitals in Brooklyn. So this is not just theoretical. This is reality. So let's look at the US picture, where men stand. Over 38 million Americans have diabetes. 1 in 4 don't even know they have it. Imagine people don't even know they have diabetes. Black and Caribbean Americans have a 40% higher risk of diabetes complications. And men are 3 times more likely to die from preventable heart disease. The average sodium intake is 3,400 grams per day. And that's another talk. That's our December talk. We're going to get into salt, real salty, and 50% above safe levels. So ignoring symptoms is the deadliest habit in men's health. So I want you to start looking at that as one of the biggest problems. Why Caribbean men are at greatest risk? Again, it goes back to cultural norms. Men are taught to endure pain quietly, work stress, multiple responsibilities, just working the grind, just keep on going and going and going and don't stop. Dietary habits, salty meats, fried foods, again, convenience. We learn a very bad lesson in the last 40 years that we're going to talk about, right? Less access to culturally sensitive healthcare providers. Our culture is not the problem. It's the solution when reclaimed with wisdom. So I'm hoping to bring that wisdom right here on this chart. So these are the top 6 conditions I want you to focus on. The top 6 conditions affecting all men, but Caribbean men more so than anything else, and women. Diabetes. So I usually say ABCs. A is for A1C, B is for blood pressure, C is for cholesterol. If you can remember your ABCs, I think 90% of your health is going to be rechecked. Okay, obesity, that's something, that will be coming up in other seminars. And the cancers, the screening, the ABCs, the S is for screening. You have to get your screening done. For women, we know it's breast cancer, but for men, it's colon cancer and prostate cancer. It's higher in this population. Men below 50 years old are getting colon cancer early. Okay, depression and stress is also underrepresented. So this is what I call the fail experiment for those who have heard my other talks. This is in our lifetime. It's a 40-year history. So in the last 4 decades, our kids, our children, imagine our children less than 19 years old have 10 times. Before it used to be 1 fat boy in class when I was in school, right? Now it's 10 times childhood obesity. Not 2, not 4, not 6, 10. I want you to think about that. 10 times is a disaster. When we thought convenience was stopping and getting a fast food, quick meal, a happy meal, well, look at what it cost us for convenience. So it comes with a big price tag. Our kids are now really obese 10 times. And that's on all continents. That's across the globe. You can see here Caribbean. You can see here all continents. This is universal now. So I have to mention at least one slide on what is diabetes, since this is Diabetes Awareness Month. So diabetes is not just high blood sugar. Okay, that's a simple one-liner. It's a metabolic disorder on how the body uses energy. Okay, it's insulin resistance, right? Where the body cannot use sugar properly, and it's not a one overnight that just happened. It's like, oh wow, I'm a diabetic today. No, it's a progression from normal to pre-diabetic to then full-blown diabetes. So you can track that over something like 5 to 10 years. If you catch it early, if you're into pre-diabetes, I was diagnosed with pre-diabetes last year. That's why I'm on this talk, giving this talk. I'm a cardiac surgeon. How could I have pre-diabetes? All right. I mean, that's just, I couldn't even get that through my head. How could I have diabetes? Well, guess what? It was real. It's real. And I could have gone down that pathway, but I didn't. I've lost weight. I'm back now to normal. Very simple. Change what I eat, lifestyle, and all from just getting a screen. So if I can do it, and if the mayor can do it, or the previous mayor can do it, anybody can do it. What does sugar really do to us? At the molecular level, sugar is a toxin. Sugar is a toxin. If you took your cells and you put sugar on it, it's going to die. It's that simple. All right. But look at it from an inflammatory It's a pathway, it's a cascade. I'm not gonna bog you down into science, but it activates inflammatory markers that causes oxidative stress that destroys our blood vessel lining throughout our entire body. So it's the entire body that gets affected. Okay, it's a massive inflammation that it does. And over time, the blood vessels that's inflamed, they become more stiff, and most diabetics have high blood pressure. So one leads to the other easily. Okay, and then when that happens, it starts accumulating this sort of fat deposit inside, and that leads to downstream heart disease. So normal, this is the number you need to remember when you go to your doctor and you ask for your A1C, you want to make sure it's less than 5.6. That's the magic number. I was 5.8 and I was a pre-diabetic. I'm now back down to 5.5. Okay. And so this is what normal is for the A1C. It's a blood test. So the deadly delay. Diabetes can be present for 5 to 7 years. If I may have been a pre-diabetic for maybe 5 years because I really didn't do a A1C. Why would I do a A1C? Right? That's the stuff we got to get out of our head. Get the A1C, get checked, and then action around it. By the time people are diagnosed with diabetes, just like the mayor's story, 25% already have vision or kidney damage. He was already going blind. Okay. Men often present late because we say, we just have these things that we tell ourselves. But regular screening, early detection, lives can be saved. So ask your doctor tomorrow, today, make a schedule, ABCs. Get your fasting glucose or just get an A1C level, get your blood pressure checked, get your cholesterol level checked, and he's going to do some screenings to see what you need for cancer screening. Why that matters? Because every man's legacy is really important. So men's health is not just personal, it's generational. What you do as a leader, people in the family will follow. When fathers care for their bodies, sons will copy. If fathers don't care about their bodies, well, sons learn that from them. Daughters will worry less if fathers were to take care of their health first. So health really determines your family's financial and emotional security. Taking care of yourself is not selfish, it is leadership. So you can't lead a family if you've left your own health behind. So you have to lead your own family. And you can see here the timeline of ER visits. It could be anywhere from, I would say, about 5 to 7 years. Diabetes is not something that just happens overnight. None of these diseases happen overnight. They can easily be screened and picked up very early. According to the CDC, 98 million Americans have prediabetes, and I was one of them. The sad part is 8 out of 10 of them, 8 out of 10, don't even know they have it. I never had symptoms. It just came on a screen. It could be you also. You can screen, go on the CDC website, type in prediabetes, and take the test to find out if you're pre-diabetic or not. By answering some simple questions, it can predict. That's the technology we have today. So very few things happen overnight. Okay, that's called acute. But chronic over time, that's what diabetes is. So we can catch it early and reverse it. If you want to reverse diabetes, catch it in the pre-diabetes process. When you move on to full-blown diabetes, it's very difficult at that stage to reverse it. So you're not alone, but you can win. So let's go over these myth busters. Diabetes is inevitable if it runs in my family. Just like what the mayor thought that his mom was a diabetic and on insulin, so he had to be the same thing. Well, the answer is no, you don't have to be. We have to get it out of our head. Lifestyle, awareness, it overrides genetics in most cases. All right. So just remember that we have the power. Now I have patients coming to me all the time and say, my A1C is 8, I'm good, right? 8 is great. Really? So I got to put them to sit down and really go over this with them. It's not great. Every 1% change from 9 to 8, 8 to 7, 7 to 6. If you're 6, go to 5. Every 1% change, just 1% change is equal to decreasing death by 21%, decreasing blindness and kidney disease and going on dialysis by almost 40%, decreasing a heart attack by 14%, decreasing getting your toes chopped off by 43%, and stroke by 12%. So every 1% is extremely critical. Do not buy into fake news that 8 is normal. It's not. Okay? This is more than 100,000 patients studied in the British Medical Journal. All right? Now, the cost of acting. You think it's expensive if I go to the doctor and they charge me for this, but guess what? The cost of complications and amputation, thousands of dollars, right? Any complication, a heart attack, 100,000, right? A stroke, depending on how disabled you are, will determine how much you're going to spend. What's the price to simply go and get your blood pressure checked? Nothing. You can go to pharmacy. We're going to show you where you can go to get your blood pressure check for free. Symptoms, most men ignore: the fatigue, the frequent urination, the cuts that are not healing fast, erectile dysfunction. It can happen in up to 60% of men can have erectile dysfunction. That's equal to some sort of metabolic problem. Blurred vision, feeling off but ignoring it. I don't feel sick, I must be fine. By the time the symptoms appear, because the human body has such good compensatory mechanisms, by the time you have symptoms, your body is ready to shut down. So the cost of not acting, the cost of these complications is what keeps the $1 trillion healthcare system going. Stop feeding that. Focus on your health. When you look at this circle, the causes of why people are hooked up to a dialysis machine. Notice they're building dialysis machines everywhere in your community. Notice that. Big dialysis centers going up. You know why they're going up? The leading cause of why somebody will sit on a dialysis chair 3 times a week for the rest of their life is diabetes. That's the number one reason. And it's full of regret. When you combine that with high blood pressure, that takes care of more than 60% of why people are sitting in a dialysis machine. That is preventable. Think about that. It was preventable. If only they got their tests done. Just A and B would have told them the answer: A1C and blood pressure. So Caribbean specific risk factors, I think we all know this: the Caribbean diet, the dumpling, the roti, the rice, right? The sedentary lifestyle, especially post-immigration. You come up to America, wow, life is good. LG, increased abdominal fat, higher insulin resistance, the environmental shift, the alcohol and fried foods are common at celebrations. So these are the things that catch us when we're off guard. So when diabetes strikes the heart, I would say about 60%, 70% of my patients have diabetes, right? So diabetes double the risk of heart attack and stroke. It causes damage to these vessels I showed you before. It damages it, and hence you need surgery. 68% of diabetics over 65 die from cardiovascular causes like heart attack. So this is not just about sugar, it's about your life. Again, just as I talked about diabetes and heart connection, they get high blood pressure. This is the sort of pathophysiology they go down. Now, let me bring you back now to that first slide I showed you, that causing death was, cardiovascular disease was number one. So when you break that down, that 20 million people down, into what exactly is cardiovascular disease anyway? It's just a term. But let me be clear now. You can see here that 14 million people of that 19 million died of heart attack, ischemic heart disease called heart attacks, and the other 6 million is strokes. So that's blood pressure. If you have such a high blood pressure, the blood vessel actually ruptures in your brain. That's how high your blood pressure is. That's how you present. Okay? So same pathophysiology in the heart, causing blockages. It can happen in the brain and cause a stroke in your brain. And that's called ischemic stroke. So the strokes, so the statistics that we think we're going to die of is happening every minute. 33 seconds, somebody dies in the United States, in the richest country in the world. Just remember that. So these myths are killing us, and it's passed down from generation to generation. So let's go over these myths and get them busted right away. Only overweight people get diabetes. Really. Many diabetics are slim. They have visceral fat and insulin resistance. So you could be slim and have full-blown diabetes. Natural sugar is better than regular sugar. No, sugar is sugar. You just have to be aware and moderation, please. Fasting is dangerous for diabetics. No, it's not. Under supervision, intermittent fasting can be beneficial if it's done in the right way and with testing and slowly. Nothing fast. Some people think a thin man have normal sugar levels. That's not true. Thin people could have diabetes also. What is this metabolic syndrome that you see people pushing a belly around, right? Well, metabolic syndrome is 5 components, but all you have to have is 3. 3 out of any of these 5. If you're wearing a belt that's more than 40 inches, for women, more than 35 inches, that's called obesity in the metabolic syndrome. When you do your blood tests, when you go to your doctor's office, if you have a high triglyceride, if you have bad cholesterol elevated, and you have high blood pressure or glucose high, these are the 5 things. Any 3. So you can have these 3 right here. You can have high blood pressure, high sugar, and you could have one of the cholesterols bad, and that you don't have to have obesity. So you could be slim and dead. Think about people who died that were slim, and you said, wow, that person looked healthy. How come this happened to them? So when you look at studies looking at that, normal weight can put a mentality state that I have a normal weight, I am fine. And these people are more resistant in getting follow-ups and checkup because of their normal weight. So don't get faked out because you don't have a fat belly or you don't have a big belly that maybe you're healthy. Let's get that myth out of here, because people with the metabolic syndrome have the highest mortality rate just by having 3 or 5 of those components. And that's why you must get screened to find out which 3 out of the 5 do you have. Herbs and bush tea will cure my diabetes. Well, listen, some herbs can help, but no tea alone can manage glucose sustainably, okay? Once you're on insulin, you're failed. Nope. Even the mayor had to be on insulin drip in my hospital until now he's off the insulin for the rest of his life. So temporarily, you need to take some medications to sort of help your body get back its homeostasis, back to normal, before you can come off medications. So you have to trust the process in this one to get you back to where you need to get to. It's normal for older men to have erectile dysfunction. Erectile dysfunction can be the first sign of some sort of vascular damage, diabetes or heart disease. So don't ignore it. People tend to take, herbal tea and herbal medicines and stuff like that. So I'm not against it. I'm just saying that you have to take your regular medications until you can prove that your numbers are corrected and that your A1C is back to normal. So until you prove that, you shouldn't really stop your medications. If my A1C is under 7, I'm healthy. No, you can have spikes, and those spikes can damage your blood vessels the same way. So it's just a guide. Just knowing what your A1C is a guide to help you know that in the last 3 months, it represents what your body is doing with your glucose control. Are you better? Are you worse? It's a guide. Use it as a guide. I'll enjoy the holidays. It's only once a year. Well, this is the season that we see the most heart attacks, the most strokes. My hospital is busy right now. It's busy right now, always during the holidays. Because when you put the perfect storm, the trigger of stress, high salt, high blood pressure, high glucose, all kicks in at the same time of unrecognizable metabolic diseases, that's when you come to the emergency room. And the price is expensive. So remember, people are walking around with 6 out of 10 people are walking around with at least one chronic disease. Now, for some of you, diabetics, you would have heard of something called non-alcoholic fatty liver disease. And if you haven't, well, welcome to the world. It's where your doctor tells you that your liver is a little bit fatty. What does that mean? Your liver is a bit fatty. Well, that's what it means. A healthy liver looks brown like this. When you start getting fat accumulate in the liver, this is called non-alcoholic fatty liver disease. You don't even have to drink alcohol to get this liver disease. And if it's left untreated all the way through, it can lead to hepatocellular carcinoma of the liver over time. So this is a serious condition in diabetics, very serious. In fact, United States, we're seeing about 10, and this is 2022, 10% of the population in America are diabetics. And with that comes 50 to 70% of our population have that non-alcohol fatty liver disease. Think about that for a second. 70% of this 10% have liver disease and a fatty liver. Globally, it's still clocking around 55 to 70% of the world have a liver problem. Let's talk about sugar and the content. This is the daily amount of sugar according to American Heart Association. How much sugar should we eat? Let's go over the numbers. You need to check the labels. Teach your kids how to check the labels. I have my kids run and go check whatever you want, but come back and let me know how much sugar they have in it. When they come back with their hands empty behind their back, they're learning faster than anyone else, because that's what we have to create is habits in kids. You need to check how much added sugar. How much sugar did they add in addition to what is contained in your beverage, for instance? But guess what? The daily allowance for women is 25 grams and for men 36 grams. So just by drinking a regular can of Coke, you already surpassed your daily limit of sugar. Just one can of Coke is going to put you in your daily limit of sugar. Think about that for a second. I know people that drink 8 cans of Coke and they think that that's healthy. And this just came out this month, October 6th, last month. Diet and sugary drinks raise the risk of common liver disease up to 60%. And if you read it, it's all over the news now, that they boldly say it out. Diet soda, yes, diet soda. And up to 1 drink a day can destroy your liver. Just 1 drink. Think about that. So lifestyle by the numbers, 50% is related to poor lifestyle choices. 70% of Caribbean men get less than 150 minutes of weekly exercise, which is the recommended weekly exercise. We're not even getting that in. Look at that. 75% are not even getting their steps in. 60% report not even sleeping for fewer than 6 hours a night. 70% say work and financial stress are constant. So our habits reflect our hustle. So it's time to reflect our health. So let's break the cycle. All right. What myths did you believe before tonight? What do you see differently now? What would it mean to lead your family different? Write down 1 myth that you've learned just now. And this is the holiday trap. You're mistaking your medications. You travel from here to North Carolina and you forget to bring your medications. Poor sleep because everybody's up all night watching movies, partying, a little bit of alcohol thrown in there. You get an argument with some family members. You start overeating. This is called the sugar bomb, we call this. And then everybody's sitting around relaxing. This is called the perfect storm between November and January. When blood sugar spikes, blood pressure goes up, weight spikes, you put on a few pounds. Yes, a few pounds well for the holiday for 4 months straight. That is called disaster waiting to happen. So this is sort of that sort of holiday disaster. So look out for it. The sugar spikes, the booze, sleep deprivation, mistaken meds, start gaining weight. This is what it looks like. Macaroni pie, the rice and peas, the roti, the plantain, and just eating and eating and eating finger foods, right? This could be up to 4,000 calories in 1 day, more than our body was created to handle. So start doing some swaps. Be a leader. Take in the kitchen. Go in there. You know, healthy food is bland. No. You pound herbs in there. You got spices and technique, flavor without damage. That's what this is called. Flavorful food without the damage. Start switching from rice and peas to something more healthy. Macaroni pie to roasted vegetables. Fried foods to baked foods. Curry goat and stuff to jerk chicken, something baked. Rum cake to fruit salad. I know this is tough, but it's reality. And flip the plate. Flip the plate means, you know, If we can just simply, prioritize, right? Reposition. You don't need to stop eating Caribbean food. You just need to reposition it. Just reposition. 50% of your plate need to be fruits and vegetables. 25% need to be grains, and another 25% in some whole protein. That's it. It's that simple. Just reposition your plate. Follow this myplate.gov and follow fruits and vegetables, 50% of the plate, and grains in a quarter, good grains, and protein. And do that for every meal. And make that a habit for you, your kids, your grandkids, and leave legacy behind. Legacy cart, grocery shopping. Have your kids go and find foods that are low in sodium and low in sugar. And start that habit from now. Show them that it matters. So alcohol, sugar, and the aftermath. It's really a roller coaster for the holidays. So just watch out for it. So how do you eat with family without offending anyone? Eat a high protein snack before going. This is really a good trick. You get full real fast with a high protein meal, you're not hungry at all. Survey the table before you serve. Take small portions. Slow down your eating. I'm watching my sugar, trying to feel good for the holidays. Keep water always at handy, right? You don't want to be rude. You're protecting your health so you can keep showing up for your family. Just remember that. You are protecting your health so you can show up for your family that needs you. So this is the survival checklist. Eat proteins before parties. Bring your own low-carb dish. Say no without guilt. After this talk, you should be able to say, hell no. All right? So move your body every day, 15-minute walk. If you're on your phone and talking, just watch where you're walking and talking. But you can go outside and walk and talk, but keep moving and get some steps in. Remember to walk with your meds. Pack a bag like this that you have your blood pressure kit. You got your glucose monitor. You got your water. You got your medication list. Don't be making this excuse, I forgot my medications. I hear that every time in the emergency room. Well, doc, I didn't take my medications. And that's why you have a heart attack. That's why you blew your brains out. All right. That's why you have a stroke. Because when you stop the medications, the hypertension rebounds. So here's one story. Mr. James, 57-year-old Trinidadian, lives in Queens, wood construction, long hours, eats on the go, no primary care visits in 6 years, collapsed at work, diagnosed with diabetes, high blood pressure, clogged arteries, triple bypass surgery, lost 3 toes from infection. Family is devastated because he was the provider, right? What a disaster during the holidays. Get screened today, right? The warning signs he missed, he had erectile dysfunction, constant fatigue, tingling in his feet, neuropathy, blurred vision, but ignored it, shortness of breath on stairs, right? And diabetics have what's called silent heart attacks because the same neuropathy in their toes, they don't feel the pain in their heart. So for the essence of time, these are local resources that we can provide for you on our website. There's you can get free screenings, diabetic screenings provided by New York City Health and Hospitals, free diabetic screenings, free high blood pressure checks. If you just call 311, that's the phone number for New York Health and Hospitals. They can plug you in your community all over New York State to get free health screening. And free health screening is offered in every single state for free. So no longer make that an excuse that, it's too expensive. What is expensive is your life and when you get admitted to the hospital. Those are the 2 things that are expensive. So no longer should that be an excuse. You say, it's too late for me. Nope. Intervention immediately is the key. And it can happen at any time. You don't have to, it's not too late for anyone. So what women want from us? Longevity, presence, partnership, a man who leads the family towards health. That's what she wants. Less pressure on everyone, for sure. So action, diabetes don't wait, so neither should you. Awareness without action is no change. So action builds momentum. So small daily decisions is what we want you to do right now. Schedule your blood tests as soon as possible within the next 7 days. These are the action steps. Choose one food swap tonight, and you're going to apply it to your next meal, as what we describe here. Talk to a family member about their symptoms or habits at the table during these holiday seasons. Go and get your ABCs done and bring it to the table and tell people my A1C is 5.5. They're going to be proud of you. It means you took the steps to go get checked out, and that's leaving a legacy behind. So lead by example. So share share this knowledge. If I'm responsible just for myself. No, your decision ripples through your community. So we want community leaders on this call, pastors, church leaders, to take the reign and bring this message of screening ABCs in your business as an employer, no matter where you are. It's not just about you. So 84 million people, 90% of them don't even know that they have diabetes. 90% of them don't even know. But it's free to check if you could just tell them, go get checked. So what you learned tonight, why early warning signs are often ignored because they don't even exist. 10 deadly myths that you have to get rid of. The holiday survival strategies, hopefully you can use, and your 5 easy steps forward as we move on. And why I do this is exactly what I said. I was a pre-diabetic and now I'm not a diabetic anymore. And that's what you can do also. So stay connected. There'll be a lot of resources. You can follow the essential 8 steps, which we will talk about in this webinar series for the next few months. Today was just on diabetes, which is here, diabetes check, but we're going to go through all of them in all the webinars. So look out for more webinars on these specific topics. Walking exercise, 150 minutes per week. A week, that's not bad. That's like 30 minutes a day, guys. And follow a plate that's healthy. Just these 2 things you can do, and you can reverse almost 80% of chronic diseases. So the goal for you is no risk. Eliminate your risk. Get to 0. Thank you very much.
Thank you, Dr. Beckles. That was great. That was wonderful. Yeah, that was a very enlightening and thought-provoking presentation. I had an opportunity to take a look at some of the faces in the audience, and we were all just kind of like deer in headlights. Like, wait a minute. I especially, when you started talking about the blurry vision and exhaustion on walking upstairs, I was like, wait a minute. Maybe I need to scan the QR code for myself and go get checked out. But we truly appreciate your time and the valuable information that you shared here with us tonight. I appreciate everyone for staying on the call with us. And at this time, I'd like to open the floor and chat for questions that you may have for Dr. Beckles.
You can put their questions on the chat too.
In the chat. Yeah, there's several in the chat. But feel free if you guys want to unmute and ask a question as well.
Yes, hi, good evening. My name is Marion, and Dr. Beckles, forgive me if I pronounce your name incorrectly. I do appreciate you taking the time to come on this webinar and bring us valuable information. And I've been listening, I was absorbing a lot of the things that you were saying, but regrettably, I can't say that I process everything because it was just a lot. But some of the questions I have for you is regarding, like you were saying, that we have this myth of certain things being cultural, but in some cases, do you see it as being hereditary in terms of, like, you know, just like you said that Caribbean men or more generally men of color, because of the phenomenon of slavery and the things that we were allowed to eat, do you see that some of these conditions we have is predicated on the diets that we were forced to eat?
Absolutely. So there is some, I would say, you know, there's anywhere from 20 to 30% of these diseases that could be accountable from a genetic standpoint that we inherited from our parents, like type 1 diabetes. You know,
Yes.
there are things that we inherited in our genes, and hopefully one day we can fix those things. But the majority, 80% is based just on choices, just choices. And that's been shown through twin study. They take 2 twins, one choose to eat processed foods and the other one choose to eat healthy, right? They have the same genetics, right? One end up disaster, the other one end up healthy. We can choose, if our parents smoke, we could choose that we want to smoke too, or we could say, no, we're not gonna ever smoke. We have choices, and choices have up to 80% can defeat our genes. So you can change your genes. Now we know that today. Before we thought our genes are fixed for life. You can change your genes, just like the mayor did. He thought his mom is diabetic, so I'm diabetic too. So you can change your genes. Genes are changeable. Even if you came through slavery and we're all here from that, we survived that. Now we have to thrive. First it was
Right.
survival. Now it's thriving. Now that we know that it's our choices we make every day, not taking that walk every day, not eating that fruits and vegetables every day. Those simple choices have more havoc than genetics or slavery.
Yes, I agree with that. But, you know, coming from, I guess, we don't have the necessary resources that sometimes that people that choose to eat healthy, it's like depending on your geographic sometimes, you know, even in the supermarkets, the quality of the food is not the same in all the areas. So people have to realize that too. So it's not just, you know, avoiding the McDonald's and the Burger Kings. You know, the problem is more in depth than that, because when you see some of the quality of foods that they're bombarding in the black and brown communities, it's just not the same thing. So that goes into our overall, you know, trying to recondition our bodies. And secondly, what you said about some of the things is cultural, like, you know, whether you're Jamaican, you're Haitian, you're Guyanese, you know, you choose to eat certain foods that's part of your culture, but it doesn't mean that those foods are good for you. It's like the African American with the chitlins. You know, those foods were introduced because that's all they were given to eat and had the opportunity. But it was never healthy from the beginning. And then we choose to continue this culture that, you know, because based on what we were allowed to eat. And so people have to recondition their minds that certain things, regardless of it being, you know, you call it soul food or whatever it is, it's not necessarily good for you. So you have to just eliminate it altogether.
That's correct. I mean, what you said is exactly what this whole talk was about, is changing your mindset, making much better choices, being aware. I hope I brought awareness that people can now make decisions based on those, what you have learned, put some action around it. So that's called social determinant of health. You can go on and you can put whatever culture you're from and put it social determinant of health, and you'll get the whole span. Everybody's social determinant of health is different for every culture. Thank you so much, Mario.
Thank you.
Thank you, Marion. We do have a question in the chat. It is from Mr. Jeltz. What is the difference between type 1, type 2, and pre-diabetes? Are there any side effects of diabetic medications that men should be aware of?
So I would say all medications have side effects. Okay, side effects come from medications, and they could be as simple as, you know, a headache. It could be GI upset. And so it's very important that I would say 85% of people don't have any side effects, but I would say 15% of people can have some sort of side effect to any medication. And it's important for them to bring that up to their doctor. Doctors are not psychics. So if I give you a medication and you have a side effect and you stop taking it without letting me know, I assume that you fell in the 90% that actually don't have side effects. You have to let your doctor know, because there are other medications that they can change to treat you to not have to live with a side effect. So just remember that. That's just number one. Number two is, when we look at diabetes, there are two major types. There's type 1 and type 2. The type 1 diabetics are basically early onset, and we see that in children. Okay, so it's an early onset and it's in children, and it's really where the pancreas is not making any insulin at all. Okay, and that's where you're insulin dependent for life. Those kids usually have a pump to help the body metabolize their sugar and their intake. That is a whole different disease compared to type 2 diabetes. Type 2 diabetes is mostly acquired. It's acquired through lifestyle. It's acquired through two things: through what we eat and our inactivity. Okay, and it's again abuse of high sugar levels. When you take what I call the carbohydrate bomb every day, that's what you put into your body. It's almost exhausting our pancreas, that we run out of insulin and we have to take insulin. Just like the mayor eating that processed foods every day, the dollar menus, right? Until here's what happens. Now that's full-blown diabetes 2, and one is pre-diabetes is an entity that's been studied now for the last few decades, and it shows that there's a range where if it's a prelude to the type 2 diabetes. And so if you stay in pre-diabetic phase for a long time, you eventually fall right into diabetes. But if you pick it up as a pre-diabetic stage like me, I picked up mine in my pre-diabetic phase, it's easier to reverse it and go right back to normal forever. There's a controversy around if a diabetic like the mayor, could he really be cured? That was on a lot of news stations. Could he really be cured? He's now normal, but he was full diabetic on an insulin drip. And so we don't know the answer to that, but so far the answer is yes. Yes. Drastic changes though. He's on a plant-based diet. You look at his suits, he lost a lot of weight, right? He's championed that to the extent he's not going on insulin.
Very good.
Yes.
Thank you.
So this
I'm sorry, did I cut you off?
no, go ahead.
Okay. There are a lot of comments in the chat about how amazing of a presentation you just delivered. There's another question. In general, in your professional opinion, is honey a better substitute than sugar?
Honey is a better substitute than sugar. The answer is yes. Anything natural, the answer is yes. Watch out for honey that is actually made with sugar. Right? There's some cheap versions of honey out there, so be careful. Not everything is honey, right? So obviously all natural honey is better, number one, but it is still sugar. It is still sugar. And again, I mentioned that before, moderation. You're not going to go and drink the whole bottle of honey tonight, right? You can use it for, just have to watch your daily intake of sugar. Your daily intake of sugar is what God created us to take in 24 hours. Don't exceed it. It's that simple. So no matter how much the honey says it is, that's part of your daily intake. Okay?
Can I ask a question, an extension to that point?
Yes, please.
How about artificial sweeteners? What bucket does those fall into? And is it safe to substitute, use those instead of sugar?
No.
Across the board, no exception?
No exceptions.
Okay.
So anything artificial, right? Anything artificial. Again, our bodies were created 40 years ago, right? These artificial sweeteners did not exist on planet Earth. Think about that. They didn't exist. They were man-made and created to try and keep these products on the market still. And just as we're finding out, that CNN article I just showed you, CNN is showing that dietary soda, what do you think is in dietary soda? It has zero sugar. It has zero sugar. Guess what it's filled up? That artificial stuff. Still destroys your liver. It ain't water. The human body is created of 60 to 70% water, H2O. Give it what it got us here 10,000 years. This is how we got here today, is with water, not artificial sweeteners. That 40 years of experiment with our kids, 10 times obese, that's where that artificial dietary is coming in. It's a disaster. It's a failed experiment. Stop the experiment. It's failed.
Very good.
It's just a matter of time before they pull it off the shelf. I'm not sure what they're waiting on.
Thank you. I have another question. It's a little bit off topic. This one is from Matthew Lyle. And basically his question is, since the skin is the largest organ, how do we go about protecting our body from all the various chemicals that we use? For example, perfumes, lotion, body wash. Do these things enter our pores? Not sure if that's a question you would like to take.
If you're putting it on your body, that's how you stop doing it. Just stop doing it. Right? You're putting it on your skin, right? Now, the skin is a protective layer. It is full of immune cells. But again, you just have to be aware of what we're putting on our body and our skin. Of course, there's all these line now. I think Oprah Winfrey have this whole lineup of natural, all natural perfumes, cologne. Again, anything natural, I gotta say yes to. Anything that have things that you can't pronounce and it's not natural, clearly it's chemicals. And you're putting chemicals on your skin. Again, those are the choices we make, but they're not smart choices. That's all. Just be aware of that. Okay, just be aware of that. That's everything we do. If it wasn't here 40 years ago, some of our grandparents are living to, almost 80, 90 years old, and the kids are dying because we're following this new regime of dietary soda and processed foods and everything else, and it's getting us sick. It's getting us sick. We're cutting down on sleep, right? You're seeing a lot of young people. You see news all the day. It's like, wow, how did this young person die so young? They're not getting sleep. They're not recharging. They're not drinking water. They're drinking something to keep them up all night and keep on. It's disaster. Okay. Get back to meditation. Get back to a community service. Follow leaders. Get into a faith-based organization. At least meditate. At least take some time and let your brain rest. We all were created to rest. 8 hours, 7 to 8 hours every single day. Every hour you take away from that is destruction to our health. So not just chemicals, it's also just what we're used to.
Thank you. Dorette Mason would like to know, are you aware of any recent research indicating that diabetes is due to an infection in the gut?
So just remember that what we eat, so we talk about your body full of bacteria. Yes, we have bacteria in our gut, and it's what's called the microbiome, something that I'm sure you've heard of, like people are taking probiotics, right? So if you eat something that's unhealthy, so for instance, just like the mayor did, he ate the dollar menu. So when you eat the dollar menu, when the food hits the gut, the kind of bacteria that consumes processed foods and some of those really unhealthy foods is different bacteria classes that, yes, forms inflammation in the gut, extreme inflammation in the gut. If you eat healthy foods, the kind of bacteria that takes over your gut is the healthy bacteria. So yes, we do have organisms inside of us, those bacteria, and it's trillions. It's not one bacteria. We have trillions of bacteria that are consuming the food that we put in our gut, and we live in this symbiosis, means we both benefit from it. But what we put into our mouth is what causes those bacteria to cause the inflammation that can, yes, propagate and worsen diabetes. And so by changing our diet, it's getting to our gut. Now, some people think that they can just take probiotics. So when you take probiotics, you take the good bacteria, and that gives them permission to eat the bad food. It doesn't work that way. Toxins are toxins, sugar is sugar. And so we just have to learn to eat healthy. And probiotics is an addition, not a way to erase what unhealthy food we eat. Very good question.
All right. Last two questions here. I'm going to consolidate these two questions. You may be able to answer them together. Jennifer Patton would like to know, is brown sugar better than white? And April Ann James would like to know, what is your choice of drink other than water?
So I drink coffee. And again, number one, coffee has been shown, it's been very controversial, but I think we figured it out. We figured it out. And what do we figure out? We figured out that people that put a lot of sugar in their coffee and milk in their coffee and those artificial sweeteners in their coffee is what's bad about it. But black coffee maybe with a little bit of honey, right, is better than coffee that's laden with sugar. You see people pouring sugar like tons of sugar, right? And so big difference. So when they broke up the study and asking people black coffee, they found that those had a health benefit rather than the coffee that was filled with half the mug of something that is like creamy and frothy and all the different things. Okay, so what was your first question on that?
Is brown sugar
Or
better
brown
than
sugar.
white?
Yeah, so processed foods. White sugar is taking brown sugar and really processing it, right? And so you go from brown sugar, which is the most natural form of sugar coming from the sugar cane, right? So yes, brown sugar is better than white sugar, for sure, but brown sugar is also sugar that you have to check as your daily amount that your body needs in 24 hours. But if you had a choice in front of you of white sugar and brown sugar, take the brown sugar for sure.
Okay. Very good. I know we have more questions in the chat. I'm not sure if you would like to take any more.
Yeah, excellent
Okay.
questions. People are staying on, which is great.
Okay. We have two more. I can possibly give you both at the same time.
Go for it.
Bernadette Paul would like to know, Bernadette, I would like to know, what is the difference between metformin and Lipitor? And there is a comment from Charles Dawes that says, it's about our ancestors. Basically, they didn't have any medical treatment during slavery, their ordeal, yet many of them lived to be much longer, much older than we're currently living to. What do you possibly attribute that to? So, difference
Absolutely.
between
Number
metformin
one,
and Lipitor, and why did our ancestors tend to
yes,
live longer?
number one, our ancestors were very active. They weren't sitting down watching TV all day. They were very active. They're active than 90% of Americans. Okay, they were moving, they were picking things up, they were very physically active, and that's what we need to get back to is activity. So that's number one. And number two, they didn't drink, they weren't drinking artificial sweeteners. Okay, they were drinking water. And guess what? I had a lady come to me and say, I am 80 years old and I outlive all my friends, but I grew up very poor in Tobago. And she said, all my friends ate meat every day, but now they're all dead. And I was so poor, we couldn't even eat meat maybe once a month. And then she asked, is that have anything to do with it? I said, yeah, you were lucky to be poor because it kept you on the right path because you couldn't afford the expensive sodas. You drank water every day. In retrospect, it's why you outlive all of them. In retrospect. Okay, so what we eat, the simple foods, water, fruits, the stuff that people throw away and don't even eat. When you go to a restaurant, they put fruits on the table. People leave the fruits behind. That's the stuff our ancestors ate and lived longer. Just remember that because it was all natural. All natural. Metformin and the other drug, Lipitor. So metformin is for diabetes. Metformin is used to treat diabetes or hyperglycemia. And Lipitor is to treat high cholesterol levels. Both of them are both very powerful anti-inflammatory drugs for our blood vessels. And hence, they're the first line therapy for treating the ABCs we just talked about. Okay? They're not in the same class or group, but they're totally different drugs used to treat different diseases, chronic diseases. One treats diabetes, which is metformin, and one treats hypercholesterolemia, which is Lipitor. Two separate drug classes altogether. Good questions.
Okay, very good. Thank you, everyone. Okay, I think that'll be it for the questions. On behalf of Kasoni and Trinbago Progressive Association of the USA, I hope you all enjoyed this session and leave inspired to continue prioritizing your health and wellness. Okay. Please, I'm sorry?
No, this has been awesome.
It's been wonderful. It's been wonderful. Please join us as we continue this series, I believe, over the next few months, touching on various other important health topics. Thank you all so very much for all of your time. A special thanks to Dr. Beckles. And everyone, have a wonderful evening.
Give me 2 seconds just to close this out because I think we really have to thank you, Dr. Beckles. Miss Mango, you've done a fantastic job. They say sharing is caring. And there are a couple things that I want to say. They say even the longest journey begins with the first step. And another saying that I like is continuous improvement beats delayed perfection every time. So we really wanted to get started, and we know that we didn't have everything perfect, but we have the elements for what I believe is a great opportunity to provide actionable information to our community. And Dr. Beckles has topics that runs the gamut. And so we will be hosting a monthly forum and addressing different topics. We'd like to hear from you as to what it is that you'd like to be covered. But more than anything else, I hope if you felt that this was helpful, you'll share the information with others and have them join us. If you have organizations or your churches, leaders in the community that will help to sort of bring people so we can share this important information, let's go ahead and do it. Like I said, this is just the start. And I'm really looking forward to the impact that this is going to have. So thank you all so much. And Miss Ruby Mango, Dr. Beckles, just a fantastic job.
Thank
Keep
you.
moving.
And I'm so sorry, Horace, for cutting you off. I did not know you had closing remarks.
No.
Thank you,
All
Dr.
right. Thank you, everyone. Have a good night and happy holidays. See you on the next webinar.
Good night, everyone.
Take care. Good night.
Take care.
Good night. Good night.
Good night.